Well, I'm happy to be here today with my friend Day Egusquiza. Here we are, April 27th, 2021. This coming Thursday, April 29th, will be the 100th day of the Biden administration. So we just wanted to schedule a little fireside chat to talk about some of the things going on related to healthcare. But Day, I just first want to just welcome you and say how great it is to see you. I'm so looking forward to the next opportunity to see you in person. And I know that you've been enduring this and managing through this as well as can be expected. And I hope you're doing okay. You want to give folks just a quick update on how you're doing? Have you've been doing okay?
Oh, well, thank you, Bill. Actually, yes, we're doing well. We have survived the worst of it, and we have definitely had a very hard year with COVID. And I think anybody, Bill knows exactly how strongly I feel about some of the comments from people who make mountains out of nothingness and then put other people at risk. So we are good now, knock on wood, that our family, you just don't take it for granted. So all of our family is well, we are well. And as I shared with you as well, I got on an airplane for the first time in 15 months, 2 weeks ago. And I'm a diamond flyer with Delta, and it's all in the United States. And I was a rookie. Oh, was I a rookie? I laughed so hard at myself. And then when I got into the airports, they had no food because there's like one food place for the entire 62 gates in Detroit. And I went, wow. So, I mean, things like that were different, but everybody was very safe. I couldn't have praised the airports and the airlines enough to keep us all safe. But it was good, and it felt good to be vaccinated and to get out and still be safe, wear my mask, but it was good. And thanks for asking.
Good. Yeah, I haven't been quite as active getting out for business as you have, but it's coming. I've got some events in May that I'm really excited about. I mentioned to you that we've got our first in-person meeting in Georgia in quite a while next week, and so we're looking forward to that. And but my family's good. We have all had COVID, interestingly enough, at different times, but we got through it and lived to tell about it. But that's really the probably the biggest thing when we think of our country right now and healthcare is the whole vaccination effort. So. Biden came in saying 100 million vaccines in the first 100 days, and the reality is he's hit 200 shots.
Yeah.
So, there's still some people that need their second shots and whatever, but that has certainly consumed people's time. There's been a little bit of a hiccup. I can't help but think of, you and I have talked over the years about just trying to keep it simple for our patients, right? And the challenges that people face trying to get an appointment to get a vaccine was, I think it forced a lot of providers to really have to rethink the process and how they were doing it. A lot of people don't know how to go in and just wait or refresh on a website to try to get an appointment. So it really presented some challenges.
Yeah, and especially when it first started, because I was one of the earlier ones to get it, I had to contact my hospital and go, this is really ridiculous. I mean, I had to have an Epic. I had to have my chart. So I had to have Epic. Since when does everybody have an Epic chart to get in line? That was very poorly done. And then the refresh thing, wow. There was a fiasco, and now of course, months have passed. And the good news is that everybody can tell that you've had your vaccination. But yeah, I was trying to help people through the foundation, and I couldn't maneuver around it.
Sure.
And so then I went to another health system 2 hours away, and it took me 30 seconds to get an appointment.
Yeah.
I mean, that's how bad one can be and how good another one, because they just took all the layers off. Just get the layers back. And it was much easier. So I think people are very blessed that we are where we are today versus where we sure could have been.
I think so. We want to try to touch on a handful of topics today. Certainly we won't get to all of them, but some that are maybe top of mind for some of our revenue cycle friends and whatnot. We've seen there's been a reversal, a delay or review of some of the Trump administration directives that were in some ways believed to limit access to care. We certainly have seen the special enrollment period at healthcare.gov, which I think is good for people. Any thoughts from you on any of that? And Does it make sense? Is the timing right to hold off on some of that stuff?
Yeah, because I think now is not the time when we're still trying to get people to get over their hesitancy and still knowing we have such risk with this massive variants that are out there now. We
Mhm.
don't need to take away people's opportunity to get healthcare.
Yeah.
And as I tried to, when I was out teaching recently, I reminded them that what we're seeing are the long haulers. And the long haulers, 25% of everybody who's had COVID now, this was a recent survey that was done, they're finding they have medical bills long after the acute COVID. So think about their healthcare costs now. Who's paying all that? So let's not be taking away Medicaid. Let's not be taking away the exchanges, which is 80% of people who sign up for the exchange, which remember, these are people without insurance who can get it. They're now showing that 80% of these people can get help with their monthly premiums with the subsidies. 80%.
Which is a big
So
deal.
anybody in our huge, in our hospitals, in our doctor's offices, anybody who says they don't have insurance, part of what I love to teach is, where's the navigator? Hospital, be a navigator. You
Yeah.
should have everybody showing them. So this is a perfect time. They also increase the amount of the poverty level that they can get help too. This can be short-term help. And that's the other thing that we've got to do a better job of teaching. We can let that family go on and get help with their subsidies for June, and then maybe they get reemployed in September. So for 3 months, they have this insurance through the exchange, which is like a Blue Cross plan or an Aetna plan. And then they can go back to their employer coverage in September. I mean,
Right.
this is a gift we never had before the Affordable Care Act. So yeah, absolutely. Expand now and then look to the future when maybe we won't have to.
Yeah, I know here in Georgia, we had the Medicaid waiver proposal, if you will, and it was just in late February that the state got word that they were going to put that on, that was being put on hold and not being approved. The thought was that during this time, during the pandemic, during this economically challenging time, that it would put some of those otherwise recipients of Medicaid in a difficult position, requiring them to work when it's such a difficult time for a lot of people to find work and keep work. The trade-off is by holding that off, they're expecting that the cost of providing Medicaid, because it's not going to necessarily weed out some of those recipients, is going to increase the cost. Now, I was glad to see, I think, I don't have the specific numbers for Georgia, but I was glad to see that some of the budget dollars being allocated, the budgets are increased. Some of the dollars being allocated are increased. I've seen some attention to mental health issues, which, as you and I have discussed before, is very, very important. But I noticed from a national budget, federal budget, the 2022 budget for Health and Human Services is 23% higher than it was in 2021 for the 2021 budget. So it's going to be interesting. Gosh, the government is spending a whole lot of money, and I just can't help but think, just from past experience, I'm concerned that at some point, some of these federal programs related to healthcare are going to feel that and be impacted by that and see some cuts.
Yeah, you're doing some pretty big gambling in everything that the economy will continue to generate. And we have to, it's like, do you bite the bullet now and then look to the future to have a healthier population? If we get them healthier now, will they not have to use tax dollars future? Think about all the Medicare recipients.
Yeah.
Forget Medicaid for a minute. Look at Medicare. That's a much bigger drain. And right. These people are going to need healthcare, and they're certainly have in the pandemic. So that dollar amount, how do you control that? Well, you're going to see a lot more provider prior authorizations with the loss of the 2 midnight rule. No, excuse me, with the loss of the inpatient only.
Yeah.
You're going to see more of that. So that'll shrink down the amount. So as much as that looks good, I think it's a short term to try to deal with the health, the long-termers, with all the seniors who got COVID, who still have respiratory issues. Well, tax dollars are going to pay those bills.
Yeah.
So I think that may make sense in the short term while we pay, and then hope to get them healthier for the long term.
Yeah. Do you think that long-term care, assisted living facilities and whatnot are gonna come out in a better position as a result of some of this? I think it opens some people's eyes to, that that segment of the healthcare community has maybe not had the resources available to them in the past that they truly need to provide for their patients.
Sure. Assisted living we get no help from Medicaid mostly, no help at all from Medicare for assisted livings. And Medicaid, the assisted living centers, which if you think about it, it's assisted living. Medicaid would be for low income, and in our work, through the foundation, we found that a few of the assisted livings will take Medicaid, like one. So assisted living is really for the people who can afford it. Then you have the skilled nursing facility and long-term care, which are not near as nice, let's be honest, as those cutesy assisted livings are.
Yeah.
And the long-term care and the SNFs, which again, short-term care for SNF, long-term care, Medicaid, those dollars that we need to put a whole lot more money into those programs for those seniors that live there.
Yeah.
I mean, one nurse for 20 patients, that's insane, but that's sort of what some of those ratios are. And you have the very low, I mean, I've been in some of these, they're terrible to look at. Very honestly, they are. I wouldn't want my family living there. And then because of COVID, we found out they died there quite rapidly, unfortunately, because they don't have the systems to take care of those infectious diseases.
You know, that's probably the part of the whole pandemic that I have just felt the saddest about, is these families that lost loved ones during the pandemic to COVID or something else, and they weren't able to be there by their bedside as they were going through all of that. It's just heartbreaking.
My husband's nephew died at 50, and his mother was in one hospital on respiratory, on a ventilator, and he was in a nursing home for treatment of sepsis. And when he contracted COVID, he was air flighted to a different hospital 2 hours away because our hospital was full. He was air flighted to that hospital and was on a ventilator for 2 weeks, and they turned it off. His sister was outside the window trying to see him, to say goodbye. They had one, so the mother and father couldn't be with their son. The father was in quarantine, the mother was in the hospital, and the sister was driving 2 hours to try to have some closure with the brother for the entire family. When it hits you like that, this is real. And then we had a funeral on December 23rd outside, a very nice family funeral outside on December 23rd in Idaho, as we told fun stories about this young man and the families. In this closing remarks, I'll never forget them. They said, "Our brother didn't have to die."
Yeah.
So now you kind of go, could we reflect back on what we want to do different next time? Because there will be a next time.
Right. Oh, no doubt. No doubt.
Hard times.
One of the other topics related to the Biden administration, and I'm not an expert on this, you are more so than I am, but just the Medicare alternative payment methods, the rolling out of some of those, I think, has been delayed some. Do you have some thoughts on what the impact is going to be for providers in that respect?
Well, I really think I like what I've read recently, that the Innovative Center of Medicare that's been around for about 10 years, they're just pausing. They want to look at this again. They're like, do we want to hold out a carrot to try to get people to want to do alternative? And we're still trying to define what value-based looks like. Sure. I listened, and that's part of it. I mean, that's a big question, because you may think you know what that means, but for a patient who's having a total knee with United, their definition of value-based is all about limiting of care. You can have one X-ray, one MRI, you stay 2 days in the hospital. That's value-based, which in my world, that's payment-based. That isn't value of treatment-based. So I really like what she said, is we need to rethink what we're talking about and align risk with outcomes, but you got to remember patients have choices. So I liked reading that they're acknowledging that facilities and doctors can only do so much if a patient goes, I don't want to do that. I mean, you could do value-based all you want, but I'm going to do what I want to do. And does the hospital and the doctor not be paid then? So that just came out today, and I enjoyed reading it going, that's good. I like that thinking of mandatory versus a carrot? How do we do it? But I heard a physician speak just the other day about hospitals acquiring each other and buying up all the doctors. And he said, you'll never change because you have so much control of the market that you'll always get some percentage of what you're charging until you don't have that kind of control. And so I was like, this is good conversation we're having here. It should make a lot of people uncomfortable, though. It made me a little uncomfortable, let's be honest. I've done this for 40 years. And I kind of listened to it going, keep your mind open, Dave, keep it open. I'm just mostly concerned when I hear value-based thrown around, like everybody knows what it means.
Right.
And the payers love it because it's a way to, I heard the payer, you know how they describe value-based as an alternative payment method. We only prior authorize high value care. Wait, what'd you say that? You've decided that for my knee, I don't need an MRI. High value authorization is an X-ray. I said, so the doctor wants an MRI and you don't think that's high value? You hear all the words are getting mixed up here.
Right.
So I think hospitals and all of us, we need to stop the crazy train a bit, stop and and get some definition of terms. And all that's going to be wrapped up in alternative payment models.
Sure. Yeah. It's still evolving for sure. You know, we've got a couple other things to get to, but one, you know, without getting too political, you know, so much of what's going on in Washington right now is already politicians positioning themselves for hopefully re-election. Again, not the presidential election, of course, but the elections that'll take place here over the next couple of years. And so, you know, some of the things that I've read is that Biden's major changes may not come until 2023 and even beyond. So, you know, once I think the Democrats want to try to get a little bit stronger foothold in leadership to further some of their causes in that regard. So you know, there were some things I think we thought they were going to hit the ground running with may be delayed a little bit longer than initially anticipated. So we'll see.
I think that I would agree with you. But I don't know about you, but I can say this very politically. I am so sick of people running 100% of their entire term is running for re-election. I mean, these 2-year terms, I know the Constitution, but if you think about today, all they do is campaign and raise money. And it's like, could we just stop that and take care of the business? So that does wear on me. At least the Senate's every 6 years, but and so when you're trying to get something done, the part, Bill, that I would totally agree with is the Biden administration likely, with the Supreme Court hearing the Affordable Care Act challenge from Texas and that ruling, there was a lot of, if you look at the polls, there's a lot of support for reducing the age for Medicare buy-in.
Yeah.
And that would probably be one of the big wins, but it has a big ticket item. You know, there's going to have to be some premiums looked at. Absolutely. And then the public option. So these are options that when you look at the cost of healthcare, and the cost of premiums, public is saying, we've got to do something different. The cost of pharmacy is the number one issue patients are most concerned about. Number 2 is hospital bills, which is interesting because we used to be number 1.
Yeah.
But I think that's because we just lived through COVID. You know, if you asked them that a year ago, they may not have done it in that order. Right. So I think I would hope we will see that within a year, giving every person maybe 50 and over the opportunity to buy into Medicare, especially if we may have to do some things to say, well, why don't you use your commercial plan? And we all know what my commercial plan is. I pay $800 a month for myself, and my husband and I together, we have $1,300 a month in premiums for the 2 of us in rural Idaho. And that's I have 2 plans to look at.
Right. Very narrow, Mark. Very narrow.
And horrible premium. I mean, $3,500 deduct, 70/30s. I have no choice. Now, I am turning 65 this year. Happy dance.
Yeah.
And I cannot wait to dump this insurance and go to Medicare. But I think there are many of us small employers. See, the Small Business Administration, their number one issue is insurance. So think about all the small employers. If they had the option for their employees to opt out of commercial and go to Medicare and opt in, what would that do to the insurance premiums for commercials for those small employers?
For sure.
It is a huge win. It's a huge win. We just have to figure out how to do it and not talk it to death for 10 years. But let's get after it.
Right.
Because there's lots of people in my and by the way, it's August, the countdown.
Hey, trust me, I've got it on the calendar. It's going to be a big deal. I may
Oh,
even have to come to Idaho to help you celebrate.
I'm telling you, I really am having the 65th party. And only because who's excited to turn 65? Oh,
yeah, right. I'm not.
I'll be dumb.
Yeah, I'll be 58
Yeah, I know.
this year.
I
I
am.
don't want
Oh,
to rush it.
I'll tell you, turning 60 was kind of a big deal for me, Bill. So when you get closer, talk to me about what that felt like and why I made some changes. Because that's when I did the foundation. It felt like it was the right thing to do.
That's great.